Ed says the best part of the show is the post show. We've heard that before, so we're gonna artificially reenact that. Not right now. So I think the part people like is the honesty, maybe, in the conversation. So by the way, you've all been on the show already tonight. We're bringing you back just in case you look familiar to people and people don't know why. Emily, James, Heidi, and Pam. So what have we missed so far that you would like people to know? This is a lot coming here in October 1st.
Well, I think one thing that's important to know is that once people actually get into the office, there's a lot of work to be done with the infrastructure. When we were on the show last a couple weeks ago, we talked about how to fill the need. When we get a young person in and we have all these preventative health care issues, we want to talk about their mental health. We want to talk about substance abuse. Are they feeling safe at home or at school? It takes a lot of time to talk about these issues. And to be able to set up an infrastructure inside the medical office or the medical home where there are different roles and different players who can address all of these issues, because it's just not going to happen in a 5-minute appointment or even a 10-minute appointment. Because young people, if we actually want to intervene and prevent things, we've got to get them to be honest with us, and that can take some time.
And I think he talked about a medical home. One of the things I think is important is that there's so many people here tonight to help people work their way through this system. It's confusing. It's a major change for people, but I'm really glad to see insurance companies represented here tonight. The federally qualified health centers represented here tonight. Private providers represented here tonight. Everybody's scrambling to learn about this, how it works, how to get people enrolled. We're going to partner with almost all of those groups for our enrollment sessions. For some of these young people, this is the first time they've had insurance of any kind. I mean, they need car insurance, they need homeowners insurance someday. So there are a lot of people here that really care about this, and I think it's great to see. And there's a lot of help out there for people.
I'm thinking of from the 1960s big information campaigns about no standing water so the mosquitoes don't grow in your backyard, or leaflets here and advertising. Where is our information on this? Is it coming, or have I just missed it?
I think there's information in a lot of different places. I mean, there's certainly information online with healthcare.gov that's being posted. We're hearing that the government's going to be using celebrity spokespeople to get the word out.
But we're a month away. And is it different in Missouri because of the law that you're breaking?
Well, you have to remember, the enrollment period starts October 1. Coverage doesn't start until January 1. And we've got a 6-month enrollment period. So, if we had started 3 months ago, before we really knew what the healthcare marketplace was going to look like, people they'd have healthcare marketplace fatigue by the time we wanted them to enroll. So I think we're going to hear a lot.
But I do think the communication has been blunted due to the law that the state legislature passed that you mentioned earlier in the program. And for now, patients can go to covermissouri.org or healthcare.gov. Or they can go to stlouisihn.org to find a community health center where they can find a navigator to guide them through those steps. But the messaging is occurring less in this state than our neighbor states.
But there's also, too, not to forget, thousands of licensed agents, health agents, already in Missouri that people can use as a resource. And I think a lot of people get worried that it's going to be too expensive. I can't afford to go speak to a broker or an agent. But brokers and agents typically do not charge fees. We get paid a commission that's built into the rates. It's already been established by the regulatory guidance that any commissions or compensation to brokers and agents paid for plans inside the exchange and have to match outside the exchange and vice versa. So, brokers and agents are available. And aside from being able to discuss the plans in and out of the exchange, they can also address, I think, important issues like, would COBRA be more appropriate in a certain instance? Or would the person be better off staying on their group plan because they'll be familiar with those kinds of plans as well? So I think there are a lot of resources. And I think that the biggest challenge is that we've all been scrambling to get caught up with what's happening. And so it's hard to get the word out about what's coming. The resources have really been divided.
I think that there's a theory in media that the media doesn't tell people what to think, they tell people what to think about. And we really, as a society, since TV came about, we have made people do almost anything and influenced people to do everything. by media campaigns. We've got to take it seriously. The city has to take it seriously, the state and the federal government has to take it seriously. We've got to encourage and tell young people and everyone to get insurance. There has to be huge media campaigns and public education campaigns. Otherwise, no one's going to do it, especially young people, because they're not incentivized to do it. If they think it's the cool thing to do to actually worry about STDs before they get one, they'll go to a doctor or a nurse practitioner and they'll deal with it.
I asked Pam if she was optimistic that we could get the St. Louis share of folks signed up, and we have less than a minute. Are you optimistic? We need 2.7 million in the exchanges nationwide for this to work.
If you build it, they will come. And right now, traditionally, we have emergency rooms. And so patients come to the emergency rooms for like $1,000 a shot. But if you build a coverage model and a primary care access, patients will come. And that's been demonstrated in the Gateway
Maybe
to
that's the
Health
market
program.
we would.